Well, for some with COVID-19, the road to recovery is a long one till they get back to feeling like themselves.
Eyewitness News reporter David Chaplain spoke to a man on how he plans to recover from the virus. David.
Jonathan, Elizabeth, I spoke to a Bakersfield man who tested positive for COVID December 19th. 4 weeks later, he is still getting medical help. 79-year-old Bob Atkinson is a retired family services director and chaplain for the Salvation Army of Bakersfield. He had been with the Salvation Army for 39 years after getting helped by them in recovering from an alcohol addiction. In December, Bob got COVID.
It's been a struggle, and this ain't no joke, folks.
He tested positive December 19th and quarantined at home. He said he was nauseous, lost his appetite, and fatigued. Bob has emphysema, a condition that affects the lungs. Coronavirus made breathing all that more difficult.
It finally got to the point that I couldn't walk 10 feet without losing my breath. And I called the doctor to see what to do. And they said, hang up, call the ambulance, and go to the hospital.
His doctor told him to go to the hospital. He got IV fluid treatment and antibiotics at Adventist Health Medical Center in Bakersfield for 2 weeks, and now has been at Encompass Health Rehabilitation Hospital of Bakersfield for 1 week. He says it can be a while till you are truly out of the woods from COVID-19.
Some people recover a lot quicker, some, and they say I'm one of them, what they call the long haulers. That means that, yeah, I'm to the point that I'm no longer contagious, but my lungs have still not fully recovered.
During this fight, Bob says God is his strength.
Sometimes he chooses us to leave us in our weakness so that we have to depend on him, so that we can show others that he is the answer.
Bob says there is no way he can express his gratitude to all the nurses as well as the janitorial staff.
These people are pulling 12-hour shifts. They're putting their life on the line to treat us. That yes, they're wearing protective equipment and they're wearing their mask. But you know, we need to really pray for them.
Doctors tell Bob he could be released as soon as Wednesday. Bob says after he gets back home and recuperates, he plans on donating his blood plasma with COVID-19 antibodies pulled out of it so it can be used for treatment for others. In studio, David Chaplain, Eyewitness News.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.